Hi everyone, I'm Charlotte Kilpatrick reporting for Vaccine Nation from the World Vaccine Congress in Washington. Today I'm delighted that we're joined by Dr. Anita Patel from the George Washington University School of Medicine and Health Sciences. To kick us off, would you kindly introduce yourself and your role?
Absolutely. So, as you said, I am an associate professor at GW School of Medicine, and I'm also an attending in pediatric critical care at Children's National Medical Center. Um, in addition to my clinical work in the ICU, I also am an NIH funded investigator doing big data analyses and prediction algorithms to fix issues we have in pediatrics and pediatric critical care.
Fantastic, you've got heaps on your plate by the sounds of things.
Just a little.
So you've joined us today for a panel on social media misinformation and how this relates to vaccine uptake. Can you tell us a bit about the key themes or concerns that were raised here?
Absolutely. So, my other job is I am an active science communicator on Instagram. You can find me if you'd like at Anita K. Patel MD, and I am primarily active on Instagram. As a practicing physician and doing science communication, it really opened my eyes to the infodemic that we have. And I know this is nothing new, you've been hearing about it on the news, but it truly is different when you're in the trenches. And so the panel was really wonderful, and I was partnered with another very popular epidemiologist called Epidemiologist Kat, who was on the panel with me. And we really just wanted to, I would say the first goal is galvanize more vaccine adjacent healthcare workers and researchers to get on social media because of this war of misinformation. And the actionable items that we really discussed during the talk was, number one, putting yourself out there and telling the truth. And I know that sounds really simple and silly, but one of the common themes of questions we received was, well, how do you do science communication when the science changes? And Kat and I had this experience of doing science communication during this evolving pandemic, where the science literally changed. And one of my goals in, number one, galvanizing people to enter to social media and also feel comfortable with it is that you'll never go wrong if you're honest. And that's just a truth. You can never be caught in a lie. There'll be no gotcha moments, because the truth is, if the science changed, I shared that with my audience. I said, you know what? We didn't think masks were necessary before, but now they are, because we are so lucky to live in a time where there are researchers attacking this issue head on. And the science should change. If we were still doing science that we practiced 50 years ago, I don't think any of us would be healthy or alive right now, So it really comes back to honesty. And then another key theme that we discussed today was spotting misinformation. And the truth is, it's actually not as hard as people think. Number one, vet your sources, understand who is giving you that medical education. Anyone that is reputable, it should be all over their social media page. On mine, it says I am an MD, I am double board certified in pediatrics and pediatric critical care, and I do have NIH funding. So now when people come to my page, they know who I am and what my background is. If you have to search on someone's page extensively to find out what their credentials are, that's a red flag. Another red flag is there's a lot of people that are essentially spreading misinformation because they have financial gain. And the truth is that 99.9% of the science communicators I know that are reputable are not making money off of the information that they're giving. I know, anti-vaxxers like to say we're all paid by pharma, and Kat and I joke that, we're waiting for our checks. And, to bring that point home, one of the big recent vaccine advancements was obviously the RSV vaccine. And I shared that I'm actually in the manuscript phase of a study that is showing that this RSV vaccine is literally going to cause me to have less business, because I'm an ICU doctor for children. And fortunately, this RSV vaccine is so effective that is going to reduce the amount of kids that are going to come to the ICU. So I feel like that's a perfect example of something that I am a huge advocate for, that literally, theoretically, could make me less money. But the truth is that anyone who's in public health, science communication, they are going to follow the science. And again, we have nothing to hide. And I think the less you have to hide as a science communicator, the more your audience accepts and digests that information.
Lovely. Thanks so much for that summary of what you discussed. So you've mentioned your social media profile, and we'll obviously link to that so people can go and find you, give you a little stalk. Can you tell us a bit about how you tackle information and misinformation and sort of any of the challenges that involves?
Yes. So, first of all, when I first started my social media page, I did not start it thinking, I'm going to be a science communicator. I started it well before the pandemic, and it was actually mostly just to share the life of a woman in academia who is getting married and had kids. But the misinformation that really became amplified during the pandemic caused me to realize that being active on social media as a healthcare worker can be one of the greatest acts of service we can do, because for every one reputable person, there are 10 that are claiming to be reputable but are trying to sell you things. So the only real way to combat misinformation, truthfully, is to get more of us, more people that are attending this conference, frankly, to get on social media. And again, if you go back to the ethos that I am just summarizing the data that we have available in our hands right now, and this could change, I think takes a lot of the fear away, because I think everyone is worried that they're going to be stuck, caught in a gotcha moment. But the truth is, if you're following the science, there are no gotcha moments. It's just evolution. So I think our biggest takeaway from our panel, and frankly, I think our mission in general, is just to get more scientists, science adjacent people to get on social media, because the only way to combat the misinformation is to share reputable information, honestly, and in a very transparent and honest way.
Great. So that really ties nicely into my next question, which was, if you had a message for the vaccine community, for everyone here today, what can they do to contribute to encouraging trust in science and vaccine communication?
Well, beyond, I feel like I've talked about social media a lot. So to bring it into the real world, because I am a pediatrician and pediatric critical care doctor, just having conversations with people without judgment. And I think that without judgment piece is the most important, honestly, because a lot of patients, and I only know this from talking to them, feel that when they share vaccine hesitancy, rather than get explainers on their specific questions, they get shut down. Say, nope, vaccines work, you should do this. That's not having a conversation, that is telling someone. So whenever in my day-to-day life, if I have conversations with friends or patients and they share that they're vaccine hesitant, I just ask a simple question: why? And once they start to really distill down to the specific questions, you can almost always answer them. A perfect example is the autism study that was a fraudulent study based on fraudulent data. But the truth is that no one in this modern times, they don't know that. They don't see the paper because the paper's gone, but they see headlines. So being able to simply say, hey, did you know that was actually redacted because the person made up the data? And actually, you should search for the article because you're not going to find it. That's a pretty concrete way of shutting down the autism argument without saying, hey, that's a stupid question and you should accept vaccines. So I think just understanding where people are and where they're at, and also never missing an opportunity. Because one question I get, from some of the naysayers in my audience is, well, you don't give vaccines anymore. And I say, of course I do. I have a captive audience in the ICU. So once they're better, the first thing I do is say, hey, have you gotten your flu and COVID shots? And that starts the question. If they say no, I say, oh, can you tell me why you opted not to? Or if they say yes, I say great, but just never miss an opportunity. And one thing that Kat actually said during the talk that we did before was, there are ripple effects. For every one person you educate, they're going to talk to 2 people. Then those 2 people are going to talk to 4 people. And it just is it's a beautiful ripple effect of where one science communicator can actually affect change in a very large stage. And I feel like me just sitting in this chair today is an example of that. I started this small social media thinking, hey, I just want to help combat some misinformation, and it's led to really fun opportunities like this. So I hope that answered your question.
Absolutely, and I think I'm sure members of the vaccine community who watch this will hopefully be encouraged to do their little bit, whether that's answering a question with more compassion or taking up an Instagram account, whatever they feel they can do. So my final question is, you've obviously brought a lot to the Congress. We heard that there were people queuing up to ask questions at your session. What did you gain from the Congress, or what did you enjoy most about your time here?
The connections. I mean, so let me give a perfect example. At the end of the talk we gave, I talked to the media relations head of the CDC, one of the randomized controlled trial heads of Sanofi. I talked to another CDC person. I talked to a lawyer who is medical adjacent that is also combating misinformation. I mean, these are people, and actually, to add to that point, that lawyer works at GW, my home institution. I never met him. And he even said, if I had known you, I would have asked you to give a talk at our conference last month. So even though I live where the Congress is being held, I have made local connections that I know are going to be incredibly fruitful in my career, and just to really round out me as a holistic provider, So it's been really, really fun.
Fantastic. I'm thrilled that you had a productive time. Thank you so much for joining us today.
Thank you for having me.